Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Laraka. May I know what brings you here today? Okay. Anything else? Okay, I'm really sorry to hear about it, Mr. Laraka, and I totally understand how painful it will be for you. Before I come to the management part, I would ask you a few questions to better understand your condition. Is it okay with you? Thanks for your cooperation, Mr. Laraka. Can you tell me when did your headache started? Okay. Can you show me where does it hurt? Mostly. Is it unilateral or bilateral? Okay, it is on the right side. Okay, and so can you tell me how severe it is? If we are on the scale of 0 to 10, whereas 0 is minimum and 10 being maximum. Okay, so is it a continuous or comes and goes? Constant. Okay, did it start suddenly or gradually? Okay, any factors which relieves your pain? Okay, any factor which worsen your pain? Okay, and does it go anywhere else, up or down? Is there anything associated with headache like nausea, vomiting or sweating? Okay, Mr. Laraka, can you tell me, do you have some strange feeling before headache occurs? Okay, and do you see hollows around the bright light? No. Did your headache started after exertion or exercise? Okay. And does your pain start on talking, eating, laughing, touching like shaving and washing? Okay. Okay, if your pain is focused around one eye and occur 1 to 2 hours after falling asleep. Okay, is there any similar complaint in the past? Okay, are you taking any prescribed medicine regularly or over the counter or herbal? Do you have any allergies? Okay, so can you tell me what medication did you use in the past to relieve your headache? Okay, and do you have high blood pressure, high blood sugars? Okay, any immediate family member suffering from the similar complaints? Okay. Okay, any major medical problem in immediate family member? Okay. Okay, if you had any history of trauma to the head. How you rate, like if it was worst headache of your life? Okay. Okay, so Mr. Laraka, I would ask you a few personal questions. Is it okay with you? Do you smoke? Okay, do you drink? Okay, so what do you do for living? So how's everything at workplace? Okay. Okay, and how's everything at home? Do you have any stress these days? Okay. Okay, so can you tell me what worries you the most? Okay. Okay, thanks for your cooperation, Mr. Laraka. I need to examine you in order to confirm your diagnosis. Is it okay with you? Okay, then I'll sanitize my hands and let them dry. Okay, Mr. Laraka, I'll be touching your face. If you feel any pain, please let me know. I'll stop here and then, okay? and then I'll press frontal sinuses over forehead, and then I'll check maxillary sinuses by pressing, and then I'll ask patient to open and close the mouth as you okay, Mr. Laraka, can you please open your mouth and close, and while asking patient to open and close his mouth, I'll feel both temporomandibular joint and ask the patient to indicate if he feels any pain on any side. So, Mr. Laraka, if you feel any pain on any side of your face, okay, then I'll palpate the cervical spine from behind. Mr. Laraka, do you feel any pain? Okay, and then I'll check the pulse, and then I'll check the BP, and okay, so thanks for your cooperation, Mr. Laraka. You can have your seat. Okay, then again I'll sanitize my hands. Okay, Mr. Laraka, what you have told me that you have unilateral right side throbbing headache, which prevents you from continuing in daily activities, and it is brought by flashing of lights while working on computer, while working on the computer or watching TV, and there is strange feeling before it occurs. So, is anything else you would like to add? Okay, so can you tell me on how many days in the last 3 months did you have a headache? Okay. Okay, so Mr. Laraka, from the information you have shared with me and examination I have performed, it seems most likely you are having a condition called migraine. Okay, and let me reassure you that it is a benign nature of headache. Okay, it is common headache controllable with drugs. Okay, and it is not any life-threatening senior problem like brain cancer or brain tumor. Okay, and so I'll ask you to take the relaxation techniques and the stress management. Okay, and take enough of sleep without sleeping pills. Okay, and take good care of yourself, and don't skip meals, and take time out to spend with family and friends, and take care of your weight. Okay, and try to cut down alcohol. Okay, and physical exercise. Okay, and try to avoid interpersonal conflicts. Okay, and learn to accept what you cannot change, and learn to say no. Okay, and for your peace of mind and for your mental health. Okay, and learn to manage accordingly to priorities. Is it clear till now? Okay, and now let's talk about the pharmacological management. So I'm prescribing you tablet Naproxen 500 mg twice a day. Okay, and you have to take it after meal. Okay, and I'm prescribing you tablet Metocloproamide 10 mg. Okay, take it once a day. Okay, and we can repeat this treatment. Okay, and as you have had, as you told that you have 4 attacks in a month, so I'm going to prescribe you prophylaxis treatment as well. Okay, so prophylaxis treatment causes less frequency of migraine attacks, and it decreases attacks by 50%. Okay, is everything clear till now? And if a prophylaxis will be effective, then I'll ask you to continue for 6 months. Then consider decrease in a dose slowly and stopping. Okay, and so I'm prescribing you tablet propranolol 10 mg. Okay, you have to take it in the morning and in the evening. Okay, for 6 months. Okay, before I prescribe, let me know if you are asthmatic. Okay. Okay, Mr. Laraka, thanks for your cooperation. Okay, take good care of yourself. I wish you speedy recovery. Here is the leaflet. It includes all the information regarding your condition. I hope it will be helpful for you. Take good care of yourself. Bye bye.